Good evening, everyone. This is a regularly scheduled meeting of the Waterville City Council. There are agendas available in the file pockets near the entrance or on the City of Waterville's website. All items appearing in the consent agenda are voted on in one motion and vote. Generally, these items are routine in nature and do not require discussion. All items listed under unfinished business or new business are voted on first, separately. First, councilors will be given an opportunity for questions or comments. Once councilors have had an opportunity to speak, citizens will be given an opportunity for questions or comments. Citizens must speak at the podium and identify themselves. Each citizen will be allowed one opportunity to speak and will be limited to up to 3 minutes. Finally, the councilors will be given another opportunity to speak or comment. Citizens who would like to speak on a topic that does not appear on tonight's agenda will have an opportunity to do so under the public comment section of the agenda. Pledge of Allegiance. Disclosure of conflict of interest. All right, presentations. I've got an overview of the community paramedicine program. And I don't know if anybody else noticed, but Chief is looking rather dapper today.
Good evening. I took a few days off and I didn't shave my beard, and I decided I wanted to dress up to detract attention from it. So I'm going to be out of the office a few more days. So when I have the opportunity, I'd like to grow it out. So thank you very much, Council, for the opportunity to present to you our community paramedic program. This program's been in the works approximately a year, and it actually was an idea that was presented to us by the president of Northern Light Hospital. At that time, I advised her that we needed to get at least a year under our belt running a successful ambulance program before that we would bite onto any other programs. We wanted to make sure we were successful, we were squared away, and we had a good foundation, and we have done that. We do have an issue, a prevailing issue that's getting a little bit worse here in town, and that's a substance use disorder. The fire department's experiencing significant call out as it relates to those particular items. We've responded many times, and Deputy Flannery has some of the data that he'll share with you during the presentation, but you know, to Head Falls and specifically to our unhoused population. So for the last year, we've also admired the police department's program that they've put in place, their community outreach officer. And working alongside Chief Bonney, his leadership team, and the community outreach officer, the fire department wanted to step to the plate with what can we do to help this issue. So we started to look for assistance, first of all, and there was a grant opportunity that came available. And Deputy Chief Everett Flannery, with his expertise coming from a hospital system, we were able to submit an application to the state of Maine for $100,000 to start a pilot program. And a private donor also was going to contribute another $50,000 to continue the program. So with his expertise, we were awarded that grant, and that grant was submitted in the council agenda as well. So with that being said, I'd like to turn the presentation over to Deputy Everett Flannery. He's been with us now 10 months. He is truly the expert in this particular area. He's done a significant amount of work with it, and quite frankly, I'm very proud of him. I'm very proud of the department, and thankful that he chose the city of Waterville. So I turn it over to you.
You look good, by the way. Very nice. Thank you. Again, my name is Everett Flannery. I came from a hospital-based agency, running Fairview General Hospital. I worked there for 20 years and looking for some different opportunity. I did choose Waterville Fire. There's a lot of work to do here in the city, but it's been very rewarding work here. So I'm going to do a quick overview here of what the community paramedic program, what the design right now looks like here in the city of Waterville. So if we want to go to the first slide. So here in Maine, this is going to be the only slide I'll read from, okay? The practice by an emergency medical services provider primarily in an out-of-hospital setting, providing episodic patient evaluation, advice, and treatment directed at preventing or improving a particular medical condition within the scope of practice of the emergency medical services provider as specifically requested or directed by a physician. So what does that look like? Well, first and foremost, community paramedicine is not a new concept here in the United States. It's slowly gaining ground here in the state of Maine, but it's existed since 2001. And since 2001, it's had many different names to it, like expanded practice, paramedicine, and so on and so forth. And in fact, in the town of Jackman, they're using expanded practice paramedicine because of its remote location, and it's very rural. And that was sort of the whole concept behind community paramedicine, is the rurality behind it, and sort of bridging and linking healthcare services with EMS being at the forefront. Next slide, please. So what we're looking at here in the city of Waterville, I've been here now 10 months and sort of been able to do like an evaluation of needs here in the city. And right now, we have a prevailing need to assist with high-risk medical patients, particularly those that are post-discharge from an inpatient setting. Other high-risk patients too, coming out of ER discharge, walking care, and that are not admitted to the hospital. And those referrals would come to us to go and visit them as a referral basis from a provider. To sort of check in how they're doing and seeing how they're doing and so on and so forth. The other initiative here, as Chief had already mentioned, is to tackle the substance use population. So, you know, those issues, whether it's head of falls, homeless encampments, and so on and so forth, and try to get a handle on some of those prevailing issues here in the city. Next slide, please. So, when we talk about referrals for high-risk patients, these are the conditions that we're talking about. So these are the types of patients that would be in an inpatient setting and then are discharged home. So what ends up happening is that these high-risk patients, they have a change in medication. They just had an acute event where they required hospitalization, and now they're discharged home. There's many cases where those patients end up failing discharge home and that require rehospitalization. And those are the type of patients that we're trying to we're trying to kind of run a roadblock and make those patients more successful, okay? And that's where we would come in those referrals and go visit them, see how they're doing. And also by doing that and maybe identifying any failures, we can reduce that hospitalization. We can reduce the burden on emergency departments and inpatient services. So these are some of the high-risk patients of congestive heart failure, chronic obstructive pulmonary disease, diabetes, and so on and so forth. That would be high on our list of patients that we could go in and make a difference and assess. Next slide, please. So what would we do in the home for these patients? So these are some of the things that we would provide. Our providers would after getting a referral for a home visit. We're talking just general assessment, vital signs, checking their blood sugar, medication reconciliation, because we all know if somebody goes to the hospital and had an acute condition, they may be discharged home on new medication. And there's a large part of the population really don't understand how medications work, or you know, if you skip a dose, that could be very detrimental. So we want to try to get in there and sort of figure this out for them and make sure they're successful home and they don't require another ambulance ride or another hospital admission. Other instances of other clinical care, the general follow-ups after a high acute hospital admission, and also doing other follow-up care for their PCP, which would include like blood draws, looking at urinalysis, INR draws. So certainly if somebody's been placed on a blood thinner, they do require regular blood draws to make sure that the medications they're on are therapeutic. And other prevention assessments, home safety, and vaccinations as well. And one thing that I learned during the pandemic, I ended up going around Somerset County and doing a lot of home vaccinations. And it wasn't just COVID vaccinations that we were delivering. It was influenza and a bunch of other things too, where we had folks that didn't have access or a vehicle and so on and so forth to get into a clinic or a hospital to get these vaccinations. And we're trying to make these folks safe. We're trying to negate them from having to come into the emergency department or being admitted to a hospital for some, terrible, viral illness. So vaccinations is definitely a part of this as well. And other educational opportunities on medications, what their medications do, what to look for, side effects, and also help them with any other issues with their chronic disease process. Next slide, please. So that's one initiative. The second initiative for community paramedicine is obviously the substance use and our unhoused population here in the city of Waterville, which is obviously has gotten worse. So right now we're at the very beginning stages. So we have a community paramedicine pilot program that we're trying to get underway, and we also have an options referral program that's going to be piloted by the Waterville Fire Department. That's administered by the Bureau of Maine EMS. And I'm proud to say that they chose our department. I've been in constant communication with them. Here in the city of Waterville, this is a process that we're gonna take on and see what happens. So what the options program is here, real quick, is we have at the point of care, we're able to obtain consent from a patient who's suffering from a substance use disorder, obtain their consent for an options liaison call, and the options liaison will be able to connect them to resources, hopefully, ultimately, get them down the path for recovery. We really need to start seeing some of these success stories here in the city of Waterville, and we have the opportunity to do it at the EMS level. Why is it taking this long to get to this referral process? Because of federal privacy laws. Okay, we can't just freewheeling-nilly just give substance use resources, patients' names and information. It's a violation of HIPAA. So we now have an avenue to do that. So otherwise, for community paramedicine initiatives for substance use, we have the options referrals. We are currently doing naloxone leave behind, and that is going to be this winter a mandate from Maine EMS that all agencies in the state of Maine do naloxone leave behind. And we're already starting to do that now in the city of Waterville. So if we go to an overdose, and particularly the rule is if the patient ends up refusing transport, which they certainly allowed to do under certain circumstances, we will leave behind naloxone. It's not at a cost to the city of Waterville or the fire department. It comes from the state of Maine. So we'll end up leaving behind naloxone so for future use, and just trying to keep these folks above water, if you will. Other prevailing issues, I found in walking with Todd and Don Kearns, who's the options liaison here in Kennebec County, that wound care is actually a big issue with our unhoused. So that's another thing that we can go down and we can assess wounds. We could take a picture with an iPad. We can send it to a doctor and say, what's the next step? Do we need to order antibiotics? Do we need to wrap this? How can we clean this? How can we make this person better? And also, along with that, we can follow up with folks after if they do an ER visit or a walk-in care visit and they don't have a primary care physician, we can get a referral to go make contact with these folks and see how they're doing. Okay, next slide, please. So why community paramedicine? I touched on it a little bit, but we're looking at ways to bridge healthcare, okay? Whether it's high-risk discharges sometimes, and I've heard this from Inland Hospital, who, by the way, we're partnering in this, and we're working with Northern Light Inland and all this for referrals and guidance. sometimes when someone has a high-risk discharge home, sometimes it's days, they said even weeks before they're able to do a follow-up with their primary care provider. To me, it's irresponsible, but it's just the way it is because there's just not enough doctors and mid-level providers here, even in the city of Waterville, to take on the patient load. So then we could get a referral, we could go visit these folks, we can do the blood draws, we can take the blood pressures, we can see how they're doing, do a fall risk assessment, and make sure that they're going to be successful at home, okay? We can provide direct communication with the patient's doctor, and then we can provide care to chronic users of emergency services. So if we have somebody who has, COPD, chronic obstructive pulmonary disease, that calls 2 or 3 times a week, if we can get a referral with a community paramedic in there and assess them, see how they're doing, maybe be able to, negate an ambulance call for them, and then we can reserve our EMS, services for more acute, conditions and emergency calls. We want to see these patients be successful on their own, and not necessarily, be a burden on city services. So we're just trying to help them, be successful at home. Next slide, please. Again, bridge healthcare gaps. We're trying to mitigate the stress on emergency services. You have to realize we're extraordinarily busy. We're running 2 ambulances 24/7, and we're doing up to 30 calls in 24 hours. It's absolutely outrageous. It's mind-blowing to me. And you have to realize too, we're transporting all these patients to 2 hospitals here in the city that are completely overwhelmed. So community paramedicine is it's known to show and prove that if we can get out there in the community more and assess some of these high-risk patients, we can sort of mitigate, these patients coming back to the emergency rooms, being readmitted, and reduce the amount of 911 calls that we have to answer. Okay. Next slide, please. So what does it look like here in the city of Waterville? What are we looking at? We're looking to staff like 2 days a week. We're looking to staff 2 days a week. Basically, day one, visiting patients in their homes, the scheduled referral process. I've already drafted a referral sheet, and those referrals would come from primarily Northern Light Inland facilities at this point in time. Day 2 of the week, we're looking at being able to go to the Lighthouse Soup Kitchen, run a blood pressure clinic, check blood sugars and everything else, just seeing how people are doing. Taking walks down to the Head of Falls and seeing how folks are doing down there, and really trying to tackle some of these issues. I mean, maybe take that day and do follow-up visits for some of those folks and do wound checks and so on and so forth. Next slide. So as the referrals come in, again, we've partnered with Northern Light. We have a commitment from them, and they love this initiative. They think it's going to be extraordinarily beneficial for them and the community and us as a department. So the referrals would come primarily. So we have your inpatient care from patient admissions, primary care, so just your family practice clinics, obviously the emergency departments. Walk-in cares, and then home health and hospice. And I also want to just point out with the home health and hospice, this program that we're trying to push forth here, it is not to step on the toes of home health or hospice. We are not replacing those folks in the fine work that they do. We're just trying to bridge those gaps. So if someone gets discharged home who's high risk, is being discharged home for a bad pneumonia, we want to get to them on day 1 or 2 of their discharge. Just see how they're doing. If there's any orders the doctor wants us to fulfill, we'll do it. And then until home health can come in and sort of take over. But you have to realize with the volume of patients and the healthcare opportunities we have and availability here in the city of Waterville and beyond, sometimes it's days to get these home health services and even hospice services into the home. Okay. Next slide. Budget expenses here, and this is our rundown of the budget. So, and this totals out the budget here with the $100,000 grant and then the $50,000 grant from the private donor. I mean, this will sustain us well into next year. And I would like to also add that in talking with a community paramedicine coordinator at the state of Maine, at Maine EMS, they're hoping by middle of next year that Maine Care will be able to start picking up the tab on community paramedicine visits. So we can actually bill for it and recoup some of our costs in doing so. And I think that's what we need. We don't want to put this on the back of the taxpayers at this point in time. We have to be able to gain revenue out of this to make it successful, and it needs to pay for itself. And as far as the quotes on the 2 vehicles, we're looking at 2 vehicles just because of limited availability. We definitely need to make sure that we have a vehicle reserved for these visits, because we can't commit a working vehicle out of the fire department. That would be irresponsible. So in order to be successful and have people go out and make these visits, we need to have a dedicated vehicle to do so. Next slide, please. So Northern Light Inland is a huge part in this. With Todd Stevens, we're going to continue to work in the future in order to make this successful. The options program, Dawn Kearns is her name. She's the options liaison in this area. She's fantastic. We're working very close with her as time goes on. And then all the folks here at the Waterville Fire Department that are doing the hard work. Again, we're extraordinarily busy. If we can put forth a program to help even reduce our call volume, even just a little bit, reduce the volume on our emergency departments, that's a success. And I just have just real quickly, I have some data here I just want to share that I ran. And I understand that the issue at the head of falls and homeless encampments have gotten worse. And this is my first experience working in the city of Waterville with this issue. But so far this year, since the 1st of January, we've gone to the head of falls 43 times, which is, I mean, that's a lot in a single location to respond for calls for the fire department. About a dozen of those involved overdoses. So out of 43, we had about a dozen that involved overdoses. And then all the rest of them are either medical or trauma complaints. And we're talking wound care. There's folks living down there with Foley catheters in to drain their urine. For whatever reason, they require Foley catheters and have medical devices that are living down there. And they're using our healthcare system. They're using our department chronically. And we're happy to go down there and help. But you have to understand that if we can get somebody down there and sort of mitigate that, we can help reduce some of that drain on our healthcare system. And that's about it. That's about it right there. And certainly I can take questions.
I want to thank you for coming to Waterville too.
I appreciate it. Thanks.
And Todd, Mike, I'm so glad that we chased Chief 5 years ago. Did you think that the stone that we threw would, you guys have done some amazing things since we got those ambulances, and our city has changed so much in the last 5 years. People worry to talk about their taxes. We never would have gotten services like this had we not have invested in ourselves, ever. It's just, thank you.
No problem.
For making our community better.
My pleasure. There's still a lot of work to do, but that's okay. It's okay.
Hi, yeah, I also am thrilled to see this presentation. I think this kind of community care is long overdue. I would, my hope is that it becomes self-sustaining, and can expand out of the pilot to days that you have on that. My suspicion is that the community could, it could warrant this kind of service on a daily basis here in Waterville, potentially, teams. I think there's an enormous need for this. I have some questions.
Okay.
How, I'm not aware that that Maine has a visiting nurses association. How would can you contrast the kind of service that a visiting nurses association would deliver with this medicine, this paramedic program.
So, like in regards to like home health type services?
Yeah, right. So that would be on the the outpatient, or the discharge side of.
It's right now our capability as in community paramedicine versus a nurse in home health care, it aligns. It aligns quite a bit. As far as like the clinical education, nurse versus paramedic, we deal with obviously, we're experts in emergency medicine. Nursing, they can be credentialed in all sorts of different things. We're not so great or well versed in things like blood draws or wound care, or addressing issues with like medical devices or something like that. So in that regard, and I'm glad you asked this, what we'd end up doing is that we would ask, and I've already asked Northern Light Inland, is that there's going to be certain topics that we will need education on. And that's fine. And there's actually standardized community paramedic programs across the country that offer this education anyways. But what we would do is we would look to our partnership with Inland and say, if you want us to do blood draws, we want to make sure that we're doing it the right way through your accredited, lab. If we're going to do wound care, we're going to need an update on that. We need some education on that to make sure that we're doing things the right way. Otherwise than that, we can provide a lot of the same sort of services, but our service is episodic. So it's going to be, one or two times maybe for the same patient before home health comes in and then takes over.
I see. Yeah.
And they're sort of the experts in this realm of home health care.
Yeah.
The one big difference is that home health can charge for their services. Community paramedicine cannot.
Well, this was my question. This was my real question. It's I'm not by any means an expert on medical billing codes or anything, but just thinking about, it's great that Maine Care is interested in this, in this kind of resource, a community resource. I know in other states, Visiting Nurses Association, they can access Medicare and Medicaid funds because of the billing structure and their credentialing. And I just, I don't know what tiers might be in credentialing in paramedicine that may have any kind of access to some sort of comparable billing structure, some fee structure. That I'm just thinking about ways that we can make this sustainable and potentially expand the service, because I think it's long overdue. I'm so excited about this.
And again, it's worked best in rural settings, but we understand even in urban settings, there's still, quite frankly, a disparaged population that just lacks that healthcare access, and no fault of their own. So we can play a big part in that. But you're right, the financial sustainability, we're hoping that will improve. So we're not always scrambling for grant type of funding, year after year after year.
So this was at the behest of Northern Lights. They came to the city.
I came to them.
Oh,
I went to
fantastic.
them.
Have you talked to the representatives at Maine General? What does that system say about this?
I've talked. So our department medical director is affiliated with Maine General, and right now, I went to Inland, being the only hospital here in the city that offers inpatient services. So we can sort of like work closely with a sort of more diverse patient population. But quite frankly, if we can kick this off and really make a difference, we would absolutely be open to involve a referral process from Maine General as well. We're just trying to get our feet on the ground, do some good quality assurance on this project, and go from there.
And where did you say? So you talked about Jackman. Where's the most robust implementation that's analogous here in the state?
Jackman's sort of a
That's a little bit of a different community. Then.
Yeah, and their program's a little bit different. So they have expanded practice paramedicine. So they almost operate at like a mid-level position, like a PA.
Yeah.
This program would not. But I know.
So those people do have access to the billing code structure.
As I understand it right now, to fund their expanded practice program right now, that's grant funded. They're affiliated with the clinic up there, but there's a lot of logistical things that I'm not fully well versed on. But I know the city of Topsom Fire Department has also implemented a community paramedic program, and they have essentially employed a full-time paramedic Monday through Friday in order to do the visits and take care of the referrals, and they've had good success on that.
If I could interrupt for 2 seconds, I'm getting messages that no one online is able to hear this meeting.
Oops.
And once we get the audio fixed, I'd like to just add a couple points, Counselor.
Better?
All set?
Can you hear us now?
Can you hear us now? Now we have an echo.
I'll mute this one. It's muted now.
No echo now.
No echo now.
Just a couple points of clarification. Prior to Everett being here is when I met with Northern Light, and the president and I had a discussion on community paramedicine. So when this came to light, Everett and I had a conversation that we needed to start with Northern Light. And because this is a pilot project and we're not asking for a full-time equivalent, a full-time position, we want to make sure, again, just like our ambulance program, that we get squared away, that the foundation is solid before we expand the program and we move forward to Maine General. Because quite frankly, I think Northern Light has enough work to keep a paramedic busy Monday through Friday.
Oh, yeah.
Just in the city of Waterville. I think if we add Maine General into this, we would be
Too much.
it would be way too much for a pilot program. So we are absolutely 100% open to it in the future, but the purpose of the pilot program is to get it off the ground. And start the educational piece and just move that way. Second point is last year I sat on the EMS Financial Health Committee that drafted 9 initiatives and that moved through the legislature. One of those initiatives was exactly what you're discussing in regards to billable codes through Maine Care and Medicare as it relates to community paramedicine. We established that there were 2 existing codes that were not being accepted by Maine Care. And again, that was a starting point for us. And I'm proud to say that went through the legislature, is going to be taken up next session as ought to pass. So we do expect some funding to occur. The other avenue is that we believe that this program will be very successful. That's what we believe.
I think so too.
And as we look down the road toward partnership with Northern Light and Maine General, they have full-time grant writers and much more opportunity, I would say, than we do for funding. So if the program is successful, I can rest assured it will be funded one way or the other. Whether it be through our grant efforts or whether it be through a hospital's grant efforts, but the critical component is getting it off the ground, trying this out a couple days a week.
And you have personnel in mind for this currently?
We do. So right at this moment in time, it would be essentially an overtime opportunity, and that's the budget at this point. And we believe that we have individuals that are willing to come in. Again, Deputy Flannery has polled the staff. The staff have been overwhelmingly in support of this. While we label it community paramedicine, you don't actually have to be a paramedic to perform some of the functions. If we go into somebody's house to draw labs, an advanced EMT can do that. An advanced EMT draws blood and starts IVs on a daily basis. So that would not be outside of the scope of our practice. So we'll have a large number of individuals to choose from.
Mayor Nancy Sanford had her hand raised. Should I allow her in?
Please. Well, bring her in, but counselors are still asking questions.
Thank you.
Go ahead.
Mike.
The reason I had my hand up was hoping somebody would see it because couldn't hear anything online.
All right. We
Thank
got
you,
now.
Nancy.
So glad it got fixed.
Thank you.
All right, so I'm going to read a comment from a citizen here in Waterville, having seen the presentation that was. This is from Diane Weinstein, who lives in Ward 6. She says, I want to give great praise to Chief Sean Essler and his partners at Inland Hospital in their development of the Community Paramedic Project, and in particular, the outreach component to persons who are homeless in Waterville. This project recognizes persons who are homeless are citizens of Waterville and deserving of acceptance, compassion, and services as every other resident. I am proud of our community is in the forefront to provide health care without judgment to people who are at risk of infections that may lead to amputations, people at risk of premature deaths, people who may have insurance but not have a primary care provider, or if enrolled in a clinic, have not had the means to get there, or after receiving emergency services, unable to avail themselves of follow-up care. This project is not judging people who are homeless. It is not judging people who may have a mental illness. It is not judging people who may have alcohol or other substances. It is not judging people with significant trauma histories. This project is being staffed by professionals saying, how can I help you? How can we find a way to provide health care to you and gain your trust to link you to other services that you already are ready to receive? For this, I am thankful, and I wish great success to the paramedics who are working in this project, Inland Hospital staff, community agencies who will be collaborating with them. Thank you, Diane Weinstein.
Nice.
And thank you for that.
Your mic.
Yeah, this, I just echo, this is a fantastic move for Waterville. It's very exciting. Just wanted to understand the budget. Actually, my question was answered by Chief Essler about the payroll is covering additional paramedics, right? And there is support from the hospital regarding a physician who's advising. How does that work?
So for the application process, which we still need to do to be designated as a community paramedic site, we have to get a signature from our department medical director, which he is completely on board, Dr. Tim Pei.
Mm-hmm.
They are still acquiring someone to take on what we need as a primary care physician medical director. So just this past week, I touched base with them, and they are actively seeking someone to provide that sort of oversight as well.
Mm-hmm.
So we're in that process, and I'm hoping the next couple of weeks we can get our application into the state.
Great. Well, I wish you much success. We'll be watching this eagerly.
Thank you.
Anyone else?
I'm looking at your budget and I'm wondering, okay, you're looking for a paramedic vehicle. Do you need a crew? Do you need an ambulance? What specific are you?
We're looking for like not an ambulance. We're looking for like more of a utility type vehicle. So there are types of vehicles. What we end up purchasing for utility type vehicles or like chief vehicles, they come with like what's called police package. So basically that gives us all the sorts of wiring and instrumentation already built into the vehicle, so we can seamlessly install radios and lights and stuff like that and be able to carry equipment. Part of this project is that we will have to carry medical supplies to do some of these visits, so it's important that we have that.
Correct me if I'm wrong, we've already reconditioned 2 cruisers for the fire department to use for other things, right? Is this something we could recondition a cruiser if we have one available for this and save some money?
I'll answer that question. As part of the grant guidelines, we applied for a new vehicle.
All right.
And at this point in time, we would be required to spend the money in contrast with the contract.
All right, I just was looking at, can we save a buck?
No, completely understood. It's just, this is what we applied for, and a copy of the grant application as well as the contract with the state was enclosed in your council agenda. At this point, going back and modifying the budget, I think would be counterproductive. And again, we knew that we needed a vehicle, so we applied for it right up front. In the council's packet, we submitted 2 different vehicles for consideration. And the reason why we did that is because these vehicles are extremely hard to come by. We have been trying to get a good lead on police package Tahoes or police package pickups. And my fear is once this goes to the second round, only one of those vehicles will be available. So I apologize for the confusion of putting in 2 vehicles, but that is the reason. We're going to choose one or the other. Both of them are priced under a state contract, and we're going to choose the one that's available once the approval process is complete.
Anyone else? Anyone in the public? You can go. You'd have to go up there, sir, so everybody can hear you. Thank you.
Plan to use paramedics? Is that what we're doing? And what kind of liabilities are we looking at for these paramedics with some of the things that they don't necessarily do on a daily basis? But those would be my questions. I mean, I have a CRMA certification, and if I go and take a class over at Northern Lights for blood draws, am I covered with, where's the liabilities on those things? Yeah.
Thanks for that question. So as far as scope of practice, way the community paramedicine program works is that nothing that we do necessarily is out of our scope of practice. So whether it's the paramedic level, or Chief Essler had mentioned the advanced EMT level, is part of their education to gain that licensure is venous punctures and blood draws. And of course, paramedic would obviously be able to do that as well. Some of the additional education that we would obtain is not necessarily like a clinical application, but how to do a fall risk assessment in the home. How can we reduce the instances of someone falling or something like a trip and fall? We dress and manage bleeding and wounds all the time, but what are the tricks of the trade if someone has a pressure ulcer that we need to go over and assess? And then if they're prescribed a certain medication or ointment, how can we apply that effectively? So nothing that we do is really outside of our normal EMS scope. There are some things that we just need additional training on to be successful. Does that answer your question okay? Yeah, okay. I highly doubt it.
Yeah. I'll interject just a little bit there. So the city of Waterville and every municipality across the state carries a medical malpractice insurance. And for us, to be honest with you, it's very low cost. I think it costs $900 a year to insure an ambulance for medical malpractice. I mean, that is very, very limited. Of course, we have some protections under the laws as it relates to the Tort Claim Act and whatnot. But everything that we would do in conjunction with the paramedic program would not necessarily be like a change in licensure. It would just be an expanded scope of practice. And as long as somebody is trained in their expanded scope of practice, the training reduces the liability. So unfortunately, because we run so many calls every day, much like the police department does, we're exposed to a lot of liability issues. And somebody could sue us for any reason at any time. But what I can assure the public is that we have good trained providers. We're not going to step forward and do anything that we're not trained or licensed by the state to do, which is why we're petitioning the state for our community paramedic designation. And we're going to do the best we can at the end of the day. That not going to prevent a lawsuit by any stretch of the imagination, but I assure you we're going to do the best we can. And we have a very robust quality improvement program where every single one of these runs will be reviewed by the deputy chief, as well as backup being reviewed by both the primary care physician and our medical director. So if we was to, do anything clinically that was not on par, that would be caught either by the EMS supervisor or a physician that would provide corrective action so that it doesn't happen again. So there's a lot of liability safeguards already built into the fire department's operation.
Any other questions? Thanks again for the presentation.
All right, thank you.
Moving on to Waterville Area Soup Kitchen update. Carla.
How about now?
Ooh.
Yes.
Oh, it was off that whole time. No wonder they couldn't hear him.
Okay. So again, my name is Carla Karen. I'm the president of the Waterville Area Soup Kitchen Board of Directors. Thank you for your time and attention this evening. A little bit about us. We opened our doors on May 2nd of 2022. Prior to that, we were serving on the street. We began serving in November of 2020 in 4 different locations in the city, attempting to procure a place for us to open to bring in our folks in our community to be able to have a sit-down meal. So that is when we started serving, May 2nd, again, of 2022. We open our doors at 8 o'clock in the morning for a light breakfast, and we begin lunch service at 11:20. Primarily from 8 to 11, it is our homeless folks that come in to come out of the weather, to enjoy a meal and to be in a safe environment. We try to establish an environment in which people that might not sleep so well outside at night can come in and put their head down and maybe have a nap and a nice warm cup of coffee, and to be able to be in an environment where they're cared for and listened to. We are experiencing some issues with that stem from addiction, in which Todd and Dawn have so graciously come in to offer some assistance. With the help of the community, which one of the concerns was for our board of directors and our volunteers was some of the activities around the soup kitchen make some of our volunteers uncomfortable. So dealing with escalated behaviors and drug addiction and all of those types of issues that come up when those are combined. So we put an ask out, and with Todd and Dawn's help, we've actually received a number of volunteers through the collaboration event that came about on September 12th, which we are grateful for. So we've had some mental health, and of course, Todd and Dawn coming in at least twice or 3 times a week. So we're really seeing the results of these organizations coming together to work toward helping our community truly become a happy and healthy community. That was one of our talking points, why we're here tonight. So that is one that is getting resolved. The other is financial concerns. We are currently serving an average of 250 meals per day or 5,200 meals per month. I gave you all a sheet. The second sheet is a graph of where we've come over this 17 months that we've been in operation. On our first month of May 22, we served 763 meals. We are now serving 5,220 meals, or an average of that per month. It varies anywhere between 250 to 300 meals a day, sometimes more than that. We also provide a breakfast, a light breakfast to our folks that come in at 8 o'clock in the morning. That wouldn't happen if it was not for Winslow Community Cupboard. Bruce, in that organization, it's a little bit lower on the sheet that I provided you here. I would say it's more like $3,000 a month of in-kind donations that Bruce provides for us. And mainly that does feed our breakfast to our people. Breakfast, desserts, breads, all of our fruit, or a good number of our fruits and vegetables come from Bruce and Winslow. The other donors for our in-kind donations are Hannaford. That varies anywhere from $3,000 to $4,000 a month. In performance, in-kind donations, anywhere between $1,000 and $2,000 a month as well. We rely heavily on these in-kind donations. Our costs, examples of some of the cost increases at Good Shepherd, ground beef in 2020 was $1.04 a pound. We're now looking at $1.82 per pound, which is a 75% increase. So not only have our food costs grown exponentially, but also the number of meals that we are currently serving at the Lighthouse. Our kitchen relies heavily on volunteers. It's a volunteer-based organization. So we need cooks, dishwashers, food prep, servers, and dining room attendants, and general cleanup as well. In September alone, we had a total of 845 volunteer hours, and that's an average of 40 hours per week. It's substantial increases all around the board. We have an example of one of our menus for the month, also on the back of this worksheet. So we really and truly are looking for some help from the city as far as helping us to continue to be able to serve in the capacity that we are, with a projection of even in a larger or a greater need as winter comes along. I don't see that getting better. I think that I see our numbers increasing as well throughout the winter. Any questions?
I have a couple, I'm asking because other organizations have started to tell us, like, so many people come from Waterville to go there. Do you track where people come from? Like, do you break down, like, if some people come from Oakland, Waterville, Winslow?
No, we don't. We do primarily, you get to know people. We have regulars. We have a lot of regulars, actually. See a lot of new faces, but a lot of our folks are the unhoused. I would say probably 55% of our population is the unhoused population. Or we have a small amount that are elderly that just come in for companionship. They like to come in and chat, and it makes them feel a part of the community. They're very helpful with some of our guests in, educating and learning to de-escalate some situations. Sometimes having that elderly person to come to you and say, well, how can I help? So it's very helpful in those situations. But no, we don't typically track where people are coming from.
And my last question is, do you track waste?
No, we don't. We have started actually taking, instead of putting all of the waste into the landfill, we've started to recycle some of that, and we have a pig farmer that comes daily to pick up some of our food waste. So that's an increasing need, as well as we're serving more. We have more food waste and prepping more food, peeling potatoes, the hundreds of pounds of potatoes that Dean gets to peel on Wednesdays. So those are things that we are trying to, in recycling cardboard tin cans. We're really trying to focus a little bit more on that as well.
Thank you.
You're welcome.
Good.
Yes.
So that we typically, if we get Wednesday and Fridays, we get donations, we almost always have a fruit salad because that is close to the end. Yep. So we'll have a giant bowl of fruit salad, but we do end up culling those that are just over the mark. So the waste is perhaps a little higher just because of the nature of what we receive. Yep. I just like the data points, but thank you.
Hi. I'm just looking at this, trying to understand the trends that are here in Waterville. During the summer of '22, there was an increase that, as people became aware, and that makes sense. And then it seemed like you reached a steady state from August of '22 till February of '23. The numbers were flat. And then, but what happened between February of this year and June of this year? It looks like we're flat again, but something happened in that time period where the numbers of meals were on this sort of linear upward projection. What's behind that?
I would say SNAP benefits were cut significantly, which resulted in a lot of our folks that were bordering food insecurity were forced into significant food insecurity.
And how was that? Yeah. And so it looks like we're at another kind of plateau now. You're around 5,200 plus meals a month. Barring any other disturbances, do you feel like that is approximately the demand?
I'm concerned that it's not. I'm concerned with winter coming, and again, a financial crisis with SNAP benefits, that this isn't going to get better. It's going to get significantly worse. I see a lot of new folks that are homeless. I see probably 4 or 5 new people a week. And more families coming in. So I don't anticipate this leveling off significantly. We are actually concerned that we're maxing our cooking space and cooking capacity at this point and would likely need additional cooking surface, a new stove perhaps, and with greater ability to fix more meals.
Thank you.
Claude.
I have a question for the council chairman and the city manager. Can we anticipate a resolution or an order at the next meeting to help fund these programs that are desperately in need of money?
Well, we have a process that was discussed last time to allocate $50,000 that in funds to outside agencies, and that application is now live. So certainly, please apply. I think it just went up recently. So. That is the process that the ARPA committee approved. And we did hear from Bruce from the Winslow Community Cupboard at our last meeting, and he shared a very similar situation. And obviously, the circumstances are linked between Waterville and Winslow, and between, clearly, the cupboard is supporting WASC. And this is an issue where it's very important for community partners to work together. And we certainly want to support both of you because you are our food network for the food insecure in this community, and it is vital.
Anyone else's questions?
Nancy Sanford is online.
Please bring her up.
Thank you. Hi, Nancy, can you hear us? Go ahead.
I can, thank you. My question is the $800,000 of ARPA money that is left, or whatever it is at this point. Can some of that be used for Winslow Community Cupboard and the lighthouse?
Well, that's certainly a matter that the council could take up. Yes.
Because the application period, the application for the $50,000 is all well and good, but that isn't going to get people money now. And so I'm confused as to why that wouldn't be taken up immediately. I'm glad to hear that we have a paramedic program, and that we need to look at the whole person. And I just hope that that some of that ARPA money can be utilized now. And I'm not quite sure why it's not been brought up before or entertained by the council before now, but I'm asking that you folks quickly look into helping both the Waterville area soup kitchen and the Winslow Community Cupboard. And as we know, the Winslow Community Cupboard, their support to Waterville is not just through the Waterville, through Lighthouse. They deliver on average 60 boxes of food to people in Waterville that can't get to Winslow, and that's twice a month. And they also have these 6 places in Waterville where they, have their trucks. And it's beyond my comprehension why, when other towns that the Winslow Community Cupboard helps have offered support and give support, financial support, to Winslow Community Cupboard, Waterville hasn't done that prior to now. So I guess that's where I will leave that for right now. Thank you.
I don't think there's a person sitting up here that doesn't want to give you money. I mean, there just isn't. And same for the Winslow Community Cupboard. Problems are that we don't know how much money to give. Like we always had the $50,000. We always knew that was never going to be enough. Like we were going to have to up that at some point. We call it outside agencies, but not every agency is exactly the same. I mean, there are things that one year we need from the AYC that we don't on the second year. I mean, there are things that you need last year that you need more of this year. So it's always that pendulum's sort of always swinging back and forth. And we've had policies in place. But that money, that ARPA money is sitting there. It's meant for the most vulnerable in our society, and that's what it was really meant for. And it is there, but you can't spend all of that on one segment of the population either. So it always becomes a hard balancing act as to what you're going to do. How do you budget for this? And last year we didn't give Winslow Community Cover any money because we were steadfast in the fact that we were going to take care of Waterville first. And does that mean that we knew that they were going to be bringing so much food? No. That's why I think it's important to track not so much like your waste, but spoilage, like what's being spoiled, how much of what's coming in is going out elsewhere. Because if you throw money at something and then you're wasting on another side because you're not paying attention, well, that's what people get annoyed with. And we say we want to spend money here to take care of the people that are here. And the people that are up here want to do that. I think, Brian, I think we've got to figure out another way to some of the things that or organizations that we team up with, how to give them more support so that they can better do their jobs while we're not wasting money. Like it's not a waste of money to feed people, but it is a waste of money to watch those dollars end up at a trash can simply because it wasn't used or people are taking more. I mean, during COVID, I remember sandwiches, all the kids, they were dropping off meals every day to people's houses. And that's sort of shifted onto you now. Like we're not doing any of that.
Can I have I want to speak on this a little bit. I think right now we are in a crisis. And I think we don't budget for crisis like this. It's the same thing when COVID happened. We didn't have a budget for COVID, so we made one. But right now we are in a food crisis. I'm facing that right now. When I saw these numbers go up, well, trust me, in my house, I feel that right now. I don't have food stamps. We live off of the food kitchen and the Winslow. We actually went there twice. So I live off of these programs. And right now, we are in a crisis. I get paid enough to just pay rent, oil, wood, and the essential that I can afford right now. But with the price of food increasing, we are in a crisis right now.
I'd like to be able to buy hamburger for $1.82 a pound. Like that's nuts.
But you don't use 60 pounds a meal.
Right.
You've been in my house? Right. No, I don't.
That's. Can I just for a second? I can answer the waste question.
Use the microphone. Yeah.
I can answer the waste question. The waste from the kitchen is a very, very small percentage. The food that we cook is, sir, if there's any left, which is rare, tomorrow I'll cook meal for 300 people. It'll be 100 pounds of potatoes, 80 pounds of turkey, and about 40 pounds of carrots. There will be nothing left. It'll be right around 300 meals. If it's less than 300 meals, it's divvied up, goes into the cooler, and goes out the next day. I do not remember the last time we threw a meal out.
Good. That's great.
Keep in mind that the fruits and vegetables we get from Hannaford
are already going.
Many are gone. Those that are not, we try to prepare almost immediately. We prepare them that day. We have a salad. We have a fruit salad. The fresh fruit that's good will often go out to our guests. They'll be put out that if we can't use it, our guests will. So we don't just squirrel things away. Food that we purchase tends to be frozen or canned for the most part. I don't recall purchasing, other than I do buy celery. I'm making lasagna Friday if you want to join us. But I do end up buying the celery because we get very little of that donated. So that the things that we buy from Walmart, for example, will be the items that sometimes Walmart is cheaper than Good Shepherd, occasionally. We don't get as much, and sometimes it's harder to handle, but I track everything we purchase, per can, per pound, per ounce. And I look at Walmart, I look at Sam's Club, I look at the opportunities that we have. Occasionally we buy from Performance Food Services because I can't get a number 10 can of tomato paste anywhere else. But I knew do know that that's $9.64, and on Friday I'll use 3 cans. So we do track cost per meal. We do track waste to some extent. We weigh all of our donations in, and then we try to process it. We've been running maybe 2 or 3 5-gallon pails of potato peels, tomato ends, pepper innards. So I would be very proud of anybody coming into our kitchen and seeing the percentage of foods that we do use and how good we are at working through produce that's a little toward the end of its life. So I just wanted to answer that if you want to see what we waste, it is about 3 bags about this big, and it's almost all peels and those kinds of things that would go out anyway.
I'm happy to know that, because I don't consider your innards or the peel to be, I mean, it's waste, but that's not, I always worry more about spoilage or things that you make that don't end up for their intended use, which you've answered, which is
Almost
great.
no purchased food is waste, because
Love
we
it.
do buy it frozen. For example, the turkeys that we're serving tomorrow are turkey breasts. I have 80 pounds that was donated by Performance at no cost to us. The potatoes, we're going to have roasted potatoes at no cost to us. So the meal that we'll be producing are 3 cases of carrots at $13 or $14 a case, whatever they're currently running. So we're getting very good at utilizing what we can get.
I appreciate that.
We got some great 5-pound hams from Good Shepherd because they must have had a couple of truckloads. They were $1 a piece. Serve that meal. But keeping in mind, even when we make sauces and soups and things like that, we're looking at 40 to 80 pounds of hamburger a meal. So the volumes were 100 pounds of potatoes will be 40 pounds of carrots tomorrow, and they'll all be gone. So I'm really pretty thrilled with the folk. Our volunteers are getting very good at working through, I'd say, ugly vegetables.
The whole company on that now, isn't it?
Have you been there
What?
recently?
No.
You should.
I agree with Claude. One of the last times I'm going to agree with him while I'm here. But I think you guys should have something at the next meeting that you can vote on to make sure that the people who are living in our community have access to food.
Yeah, because it's not just food, it's basic needs. Because we're concerned about housing, but when we're looking at housing, food is also a basic need. So if housing is on top of our list, food insecurity should be there too.
Good with that. Please, ma'am. Or you
Mayor,
can stand here
have-
and use this one.
We have two other folks online that would like to speak as well, Mayor.
Okay.
We started with a budget of $72,000. That was in May of 2022. We are now at $200,000. We survive only by donations and grants. We need $16,000 a month. That's conservative. We can't do it alone. We need help. Or we close.
I think you're going to get the help long before you have to close. Bruce.
Yes, can you hear me?
Yep.
Okay. First of all, I want to say thank you very much for allowing me to speak, and I'll try to keep it as quick as possible. I've been trying to get to the council meeting just so that the council knows what exactly Winslow is doing. Not only do we have the food trailers, at multiple locations in Waterville, things that aren't publicized. We go to Seton Village once a month and we help the senior citizens. We go to Educare once a month and we help the families and the children in the afternoon. We're sending food down to the head of the falls to help the homeless every week. As well as the evening sandwich program, Northern Light Hospital with their in-house food bank for the employees and for patients that are going home that possibly have no food. So there's a lot more programs that we're doing that's helping Waterville. And I know we say Winslow because that's how we started it back in March 28th of 2020. But of the 271 families that we serviced last Thursday, 33% of them were Waterville residents. The food bank trailers that go out, as of today, we have hit 23,000 households for this year. And even that we're in multiple locations, and I don't have the numbers now, and you know, if I am invited back to a meeting, I can give you the, you know, the numbers. They don't have to be at that town to go, or from that town to be at that location. So when I am in Fairfield and I am in Clinton and I am in Skowhegan, I get Waterville residents all the time. There is a huge need in Waterville right now, as well as Nancy mentioned earlier, the deliveries. 90% of my deliveries are from Waterville. And the reason why we're doing Waterville is because the Waterville Food Pantry will refuse to do deliveries, unlike Oakland has deliveries, Vassalboro has deliveries. So if someone calls our food bank for them, we refer them to their own food banks. We don't have that option in Waterville. I don't have the answer why, but that's the reason. And it's just some of the numbers, 1.465 million pounds, sorry, is what we have distributed into northern Kennebec and southern or Somerset County to date as of today. And the other thing that I want to point out is I send a mass email out to all the food banks in the area, evening sandwich program, WASC as well, like I said, Inland, to share this produce with the other food banks so they can help their clients. Waterville has not taken me up on it for a year now. If you're funding, and I don't know budgets, if you're funding Waterville, I would want to know why they're not stepping up to take care of their own residents. And if they're not, you know, please help us because we're picking up their slack.
Who's running the other the other food system in town?
Well, I believe the Waterville Food Pantry is located in the Methodist Church. But, you know, as we said before, Bruce, and you gave us a beautiful presentation at the ARPA committee. And yes, we absolutely see that you are serving Waterville and that there is a great need. You know, the ARPA committee has designated a process for how we are going to delegate the funds that the council voted on to allocate from our ARPA reserves to this outside agency. So, and we can change that. The council has the power to do that. So we can certainly discuss that. But I just want to say we wanted to have a process that was clear. And so that's what we did. And that's why we have what we have right now. We did fund the Lighthouse last year, as well as several other agencies, including the Maine Children's Home, et cetera, et cetera. There are many requests, and we do have to prioritize. The deadline for this particular process is November 1st, and we had wanted to make our decision by the end of that month. So it's 2 months away. I realize that seems like a long time right now, but just so that people know what the timeline is. And the other point, of course, is that ARPA funds are limited. Once they're gone, they're gone. And some we've allocated right away, and some we should. But I think that's important for us to keep in mind. You know, we've just been through this whole budget season where we talked about priorities and all the things that the city does to provide for the well-being of its people. Certainly eating is high on the list, but we also have limited resources. So I'm wondering, can the United Way help? Are other towns helping? What are, fundraising is always an activity that needs to happen. And I've actually volunteered grant writing for the lighthouse. So, I think a lot of people have stepped up. So it's something that the city can help with, but it can't solve the problem, which is enormous. So
I don't think the process is flawed. I think it's just underfunded. You're trying to spread.
Right, exactly. And we did discuss that at the ARPA committee. I mean, $50,000 is not going to go very far.
No.
So maybe we just need to revisit that and look at expanding the amount. And we can certainly do that at the next meeting if that's what the council wants to do.
Go ahead.
Anna Holdener, Ward 7. I remember Carla approaching me back during the pandemic asking about locations to serve meals when WASC was still first getting started. And they really have come a long way from literally serving soup out of a trunk because that is what they did. They cooked in their own homes and they brought the meals around to different locations. Food insecurity is a huge issue. I also have often hang out with Bruce at the food truck. And so if the city council doesn't invite you back, I invite you back.
It's always open.
There is such a huge need for food resources for folks. And, Rebecca, you're right. It's not something that the city's going to be able to take on. If you guys can or would consider changing the funding a little bit to accommodate some of these organizations and programs that really are giving people the literal sustenance of life, that would be awesome. But I also want to take it one step further and really kind of appeal to the greater, to all of Waterville, to the greater community, because not only do they need money, they need volunteers. I know Bruce is often short on volunteers. He recently did a video on Facebook requesting volunteers, especially volunteers that know how to drive a trailer. Carla just talked about needing volunteers, having bodies to actually help do the work. That is a huge thing. And I know, I'm always trying to recruit volunteers for my own group, but for these two agencies these two organizations that do so much for not just Waterville, but the surrounding areas. I really want to encourage people to take a look at your calendar, see if you can take a day off to stop in and help out at the lighthouse or to drive the truck for Bruce, because these programs really are invaluable. And like Carla already said, this is just the beginning. It's going to get worse. Mm-hmm. It really is. So.
Yeah, especially too with there's a lot going on right now with SNAP. SNAP is uncertain right now. So a lot of families are all going to struggle. We do have the pandemic of housing. Now on top of that, there is food insecurity this year, which is on the rise.
Absolutely.
Yeah.
Thank you.
I actually think that food insecurity and unhoused go together with what we're facing from 8 to 11 at the soup kitchen. They're just very emotionally triggered. There doesn't take a lot to get them upset. And then we just need folks that are able to, I want to understand what is happening. Can we go and talk, and take it out of the dining room so that it's not escalated? So de-escalating these emotional outbursts, and they really don't mean to get upset. But when your world is this small, you worry about, where am I going to eat today? Where am I going to sleep tonight? And as bad as the substance use issue is, if you were homeless, think about that. We can go and get a prescription for something to sleep or to help us with anxiety. These people can't do that. They can't do that. Can you imagine sleeping outside at night? Mice on you, spiders on you. I mean, those are just things that I think about. It's so small. That's such a small concern considering where they are right now. And that is where we try from 8 to 11 to really mitigate those issues with the help of Todd and Don and Chief Bonnie and some of the police officers that do have to respond. I see this every day. They're very kind. They're very patient. And I think that we need our community at large to try to come to understand why they may be panhandling. They might be panhandling to get enough natty daddy to sleep tonight or to not die out on the street, because alcoholism is deadly. If they don't have a certain amount, they can die. So that is why I don't hesitate to give somebody $5 if I have it in my little side compartment in my car. I will give them $5 because that might keep them alive tonight. So, but I thank you. I thank you so much for hearing us. I appreciate your time. And if anybody has any more questions?
Not right now, but I'm going to give Maureen her couple minutes. And then we can move on. Maybe. She's in.
I'm here.
There you go.
Hi, folks. Good evening. Thanks, Jay. Well, this has all been very informative, I'm sure, for everybody. And I just want to double back and make a couple of points. From my email that I had written to city leadership, when I was crunching some numbers, I think the work that so many people are doing is absolutely heroic. There's no doubt about the lighthouse. They're keeping people alive. So that certainly is well recognized. But back to Bruce and the Winslow Community Cupboard and their deliveries into Waterville, that is actually a very substantial piece of the social welfare net. And it's not only the homeless. I know many people who are housebound. I know very many elderly who are absolutely dependent on this food. I know working middle class people who want to be at these truck sites when they come into the 5 or 6 areas in the city. I know the 32% of the people who go on the second and fourth Thursdays out to the Winslow Community Cupboard's actual facility are from Waterville. That's 32%. So if we factor in the other people served that aren't going to their facility because they're all in a car, and we look at all these other sites where food is delivered to, we can easily come up with a number of 40 to 45% of all of his distribution going into Waterville. And when I look at it in terms of tonnage, like I tried to stress, and if we say this to the community and we say, do you realize that 281 tons of food have been delivered into this community in such a short period of time? We're not even through this year, and the number will go up. I think that what we're faced with is a couple of things. This is not just a critical, imminent need. This is going to be an ongoing need. As Flavia said, and other people have said, this is going to get worse. So as to what Rebecca said, I actually do honor process. You have to have a process. Otherwise, you have chaos. But we don't know what we don't know. And when that process was set up, people did not really realize we were going to be where we are today. So I ask you to abandon that process, because even $50,000, if you divided this between WASC and Bruce, it's not going to be enough. So I think also what the city has to begin to think about, and I would strongly encourage you to do this, is how are you going to budget for this in the future? Because you're absolutely right. We're talking about finite funds. These ARPA funds they'll go away, and they have to be used for other things. But I would ask you to open up whatever portal needs to be opened up and look at how much more money you could take out of whatever this fund is. I actually don't understand your budgeting process. I prefer not to get into the weeds of money. I have no skill whatsoever with accounting, but I can crunch basic numbers. And we need more money. They need more money. And if the Winslow Community Cupboard were, God forbid, to make a rational decision and say, you know what, we're really struggling. And if we pulled back and we didn't deliver to Waterville, we would be able to maybe give more to those smaller towns that do give them money. But if that happened, we would have a serious collapse socially. it would not only be the poor homeless, the people who go to the Waterville Area Soup Kitchen, the evening sandwich program. He delivers also to the shelter, the South End, the North End, and these other sites like Seton Village. And I can call him at any time and he'll deliver to people who are in need. So it's a really huge undertaking. It's probably the singularly biggest social service in Waterville when you consider what he's doing and the number he impacts. Because in that group that he impacts is the Lighthouse, is the evening sandwich program. So I would just wonder how going forward, because this need is not going to just, you're not going to throw money at this and it's going to go away. This is something that's going to be continuous. And as god awful as that thought is, it's a fact. And so I think we need to find a way to quickly release money to these two important social welfare services that we absolutely need. And then I think we may need to consider, what are we going to do going forward? Because this is not going to go away. So anyway, thanks for listening to me. And I'll wrap it up. I think the speakers before me did a great job in their presentations. And that's it. God bless everybody. That's all I'm going to say tonight.
Thank you, Maureen.
Thank you.
Anyone else? All right, city manager's report.
All right, thank you. I want to start off by thanking the fire department. I had an opportunity to spend some time and meet with all 4 shifts of the department. I really want to thank them for their time, for sharing their thoughts with me, their experiences with me, and giving me a better sense of what they do each and every day. So thank you to the entire department, as well as the leadership. I was really glad to get in there, really impressed, and a lot more collaboration there. So thank you guys, appreciate it. Employee recognition, we've begun our employee milestones certificate program. We are getting around to various departments. We have many, many more to do. So thank you to all those who have participated so far. Many more to go, but again, I think it's really important that we recognize so many folks for so many years of service. We have a lot of really long-term and dedicated employees here, and I think recognizing them for their commitment to this city and again, everything they do every day as public employees is really important, so thank you. I'd also like to recognize our city clerk, Patty, who recently received from the Maine Town and City Clerks Association the Lighthouse Award for her leadership in her profession. It was at their conference in Augusta. I had the opportunity to go down for that, so congrats to Patty. She continues to be a leader in her field. So thank you. Next date for city manager's open office hours will be October 16th, 2:30 to 4:30, this time at the Waterville Public Library. All Waterville residents and local business owners are welcome and encouraged to attend. Had a pretty good turnout last time, so thank you to everyone who did come out, and I look forward to our next session again, October 16th at the library, 2:30 to 4:30. I'd also like to thank Waterville Public Schools. I've had the opportunity to get into all of our public schools, meet with staff, with the exception of one still upcoming, the junior high, but meet with staff, meet with the principals, talk with some students. It was really, again, enlightening. I learned a lot. It was a really good opportunity for me to get out and see firsthand what's happening there. So thank you to faculty, staff, students for your hospitality at all of our schools. It was a pleasure to be with you, as well as Educare, where I also went. Again, impressive facility. So thank you to everyone there. Again, a lot more collaboration in the future. Our next council meeting will not be here, we hope. We are completely on track, I think, at this point, to have our next council meeting at 46 Front Street. Again, thank you to Public Works for all their efforts here in getting this process going. And thank you to everyone, city staff who will be involved. This is Patty also. And moving us out of here into our new home at 46 Front Street. So again, look for our next meeting in October to be at our new home, in our new chambers at 46 Front. Final reminder on Hazardous Waste Collection Day, as well as the yard waste drop-off at Public Works. Those dates are upcoming. Lastly, I just want to mention the library will be having their, for the first time in 4 years since before the pandemic, their Murder at the Epilogue Club event. It's an interactive murder mystery event, October 28th at 6:30. Tickets are limited but still available. For more information, please contact the library. I think this is going to be a great event. Again, first time since the pandemic started that they're offering this exciting event. So please check that out. And lastly, I just wanted to mention October 16th, early voting will be starting also at 46 Front Street. So please get out and vote. We do have an election here in Waterville. We have obviously a contested mayor's race as well as one contested council race. And voting is always a good idea. So we encourage your participation, vote early. And again, 10/16, that starts at our new facility, 46 Front Street. Thank you.
All right. Any questions? Quarterly finance report. This is a quick one, right? We've had a lot of presentations today.
Maureen Osbrook has her hand raised again. Should I don't know if it's an old hand raise. Let me just check. And then I will also promote the finance director for the presentation. Maureen, did you have additional questions or comments?
No. Let's bring Christina.
Okay. Christina, can you hear us okay?
Can you hear me?
Yes.
No. Yeah.
Okay.
Hi,
Can you
Maureen.
hear me?
Yes.
I'm sorry. I just had one quick question. Does anybody know when we will go back to the regular hours at general assistance?
So approximately 2 weeks. Again, these current hours are due to some medical leave with a number of members of our staff in that department. We have been monitoring that closely. We appear to have more than adequate coverage, but mid to late October, that will be changing back, depending on the situation with those employees. But mid to late October, we will have more regular hours.
Are we getting any help or backup from other communities?
The City of Augusta is helping us out a great deal, so thank you to them.
Thank you.
Christina, can you hear us okay?
Okay. I can hear you. Thank you. Can you hear me?
Yes. Go right ahead.
Apologize for not being there in person. I've had some challenges, but so the financial report that I provided to you, I developed a different format for listing it for the council to review. I took the budgeted expenses against the actual expenses. It shows the expense differences in each category and put on the same line the budgeted revenue, actual revenue, and revenue differences so that you could fall directly across each line and see where each department was for last year. And I remind you that these are the unaudited year-end financials for 2023. I made notations on the bottom of the left side of the report, which lets you know that your beginning fund balance on June 30, 2022 was listed at $11,558,279 in the audit. The council had voted to use $2,085,000 in the 2023 budget, and then an additional $2 million to offset the 24 budget. It is expected, however, the city will recoup $1.684705 in excess revenues and non-expended funds for the 2023 fiscal year. This would bring the general fund balance to a total of $9,157,984.03. The Waterville Charter requires a fund balance of 12% to be held in reserve. So based upon the 2024 budget, which was $58,089,061, 12% of that would be $6,970,687.40. So the difference between the two is a $2,187,296.63 positive to that fund. So there are a few lines I wanted to touch on. One was the airport expenses, which were significantly over budget in that year. That is on your second line down. But most of this increase was due to jet fuel prices. And on the other side, the revenue increases were substantial too to offset that. So they sold a lot of fuel. So that's why it's on both sides. It pretty much equals out in the end. Code enforcement had significant savings in expenses, which were created from the vacancies in the administrative assistant position that remained unfilled for over 6 months. The engineering department closed with a substantial amount unutilized in expenses, and that was partially due to the $150,000 that was placed as a contingency for the build project. The fire and rescue shows a significant revenue increase to the EMS activity and the call volume. The police department closed with a strong unused balance in the expense side due to open patrol officer positions that have been filled since that time. And the public works budget showed an overdraft of 577 on the expense side, but a lot of that had to do with motor fuels, and not only the cost, but also the way that we budgeted it. They were posting revenues against expenses, and for clarity and better tracking purposes, I've changed that so that all expenses go there and all revenues go in on the revenue side. So at the end of the year, not all revenues had been credited by outstanding amounts owed by other departments. So that should be a balance also between the two sides. And other than that, the overages were in the salt and sand lines and on traffic, painting and striping. So that's a summary of the total.
What, I know we're required 12%. What is it currently? What is it standing at now?
Currently, at the close of the year, there was 9,157,984, of which you need to maintain for the 12% 6,970,687.
So 15, almost 16%. Okay. Thank you. Okay. Oh,
Is there any further questions?
Yeah, Claude's coming.
So as I understand it, Director Therian, last year we budgeted to use $2 million of our reserve funds. But after all is said and done, we only used about $1.5 million. Is that correct?
You budgeted to use $2,085,000, but between excess revenues and non-expended, you took in $1,684,000. So your difference there is actually closer to $400,000 that you actually utilized out of the $2 million.
And is it also true that most of the underspending was due to our inability to fill all the positions that we had budgeted for?
Yes, it's a lot of it that was due to openings of staff that we could not fill those positions.
Good. I just think it should be noted that we did better than we thought last year. And hopefully the management this year will be just as parsimonious and careful with the taxpayers' money. Thank you, Director Therian.
Thank you.
All right. Moving on. Thank you.
Thank you.
I'm coming down to get candy tomorrow. All right. Let's see. Council comments or committees? Claude.
Well, the Comprehensive Plan Committee has not formally met for the past couple of weeks. the planning director was sick at one point, and we have been discussing with the, however, with the city manager setting up a schedule for public meetings to discuss the comprehensive plan and the idea, I think, at this point is to use the new space on Front Street on a possibly on a weekly basis. We haven't set a schedule up yet, but to have public meetings to start to discuss what the various chapters. So there'll be, I think, more information coming on that probably at the next meeting.
I want to reiterate to people listening tonight or anybody that'll watch this later over the next 2 weeks, before you pay your property taxes, please check and make sure you got your I's dotted, your T's are crossed. I've been going around with a copy of this, what Colleen passed out to us, house to house in my neighborhood, because I know a good many of my neighbors or constituents in my area do not use Wi-Fi or things like that. So I've been trying to let them know about it. I've found 4 veterans that knew nothing about the veteran program or veteran exemptions. 3 of them had never heard of it. The 4th one knew about it, but he thought you had to be 65. You only have to be 62. I missed it by a year. But please check with the assessor's office before you do your taxes or pay your property taxes. Make sure everything is on the up and up. You got everything covered. I got a whole lot of people that were concerned they were going to be getting kicked out of their houses this year. That's why I've been going door to door to make sure everybody's good. Thank you.
Just want to let everybody know that on Friday, October 27th, the Woodland Senior Living of Waterville will be hosting a trunk or treat event at their West River Road facility. My wife and my son Jack are going to be participating, and they are currently recruiting 4 more vehicles to join. This event will provide a safe trick-or-treating opportunity for children and will also allow the residents to enjoy a nice trip down memory lane and seeing the kids all dressed up. The residents in the facility have been very involved in the planning of this event, and I did tell them that I would spread the word. There is more information on the Woodlands Senior Living Facebook page, and if you would like to reserve a spot to help out, call and speak with Kristen, and her phone number is 861-5685. Thank you.
Nobody online.
Oh, I've got one other thing to just to note. We don't have a proclamation this year for Indigenous Peoples Day, but it is next Monday, and I think we should take a moment to recognize the folks who were here before us Europeans.
One moment, please hold. Nancy Sanford. Hi, Nancy.
Hi again, and I'll be very brief. Just a question. Since I'm very happy to know that you folks that the city council chambers are going to 46 Front Street. My question is when that was first talked about, there was talk about a warming and cooling center. Is there consideration for this winter, which is coming soon, for warming center space there?
You know, I will say yes. And one of the conversations I've had with Chief Essor is regarding emergency shelter space, warming centers. So I think we will have some opportunity there to provide warming shelter in definitely more severe weather events or extreme cold events. I'm not sure if this space can be an everyday sort of shelter space to house people, but certainly we need a facility during major weather events, major cold snaps, major heat waves, to get people in and to provide some sort of shelter. So I think we absolutely anticipate being able to do that. But if the question is more of, is this going to be an everyday sort of shelter space, I think that's a much more difficult proposition. Being at this space will obviously house council chambers, also meeting space for other community events, maybe boards and committees that will meet there, other community groups can utilize the space. So I think there are many needs on this new space, but shelter is definitely one of them. And so I think we absolutely intend to be able to utilize this space during, we'll say, extreme cold events, extreme weather events, et cetera, to get people in off the street.
All right, thank you.
So moved.
Second.
Just a show of hands.
Full house.
Yay.
Read by. Yeah.
So
read by
moved.
title.
All in favor? Authorize the issuance of a special amusement license to president and trustees of Colby College, doing business as Colby College Joseph's Family Spa.
Move to adopt.
Second.
It's a restaurant. Not that kind of spa.
Accept the 2023 Community Paramedic Grant.
Move to adopt.
Second.
Just to follow up with the question that Councilor McCormick raised about the vehicle. As I understand, you're looking for a Chevy Tahoe. That's with the two choices. And I don't want to get too far ahead here, but we've got a item coming up in terms of leasing Chevy Tahoes for the police department. Is there any way to work out a way to use either the old vehicles from the police department or to include the vehicle for the fire department in the lease with the police department vehicles?
That's a very good question. So the first part of that question was, should we repurpose a used vehicle? Again, we exclusively applied for this grant to replace or to purchase a new vehicle. They've allotted us the money to do that. If we did not decide to purchase a new vehicle and we purchased a used vehicle, then that money would just simply go back to the state. So it wouldn't be in our interest to do that. In regard to the lease, that's a very good question. And Chief Bonney and I have had this conversation for months now as he's been going down the road of leasing vehicles. And in the case of the police department, where they run their vehicles all day, every day, the longevity of that vehicle is much less than a fire department vehicle. And to be quite honest with you, a fire department vehicle is going to be able to last 10 years versus 3 years. So for us, exchanging a vehicle every 3 years would essentially be a waste of money at this point. Whereas we can purchase the vehicle up front or lease it for a short duration and then own it at the end of the lease. We wouldn't want to turn it back in. We would have more equity and more value in just purchasing a vehicle outright at this point.
No, I just think it's something we ought to keep in mind as we start to change the way we look at our
I agree with you.
capital vehicles. That's the only reason I raise it, because I think it ought to be something that's on the table.
Yeah, I don't disagree with your point. Just for this vehicle, again, we have grant money that has been allotted to purchase outright a vehicle that will last the department in this capacity 10 years. So leasing this particular vehicle just doesn't make sense to us. But moving forward, I think it's certainly a conversation.
Yeah, I just want to say it was brilliant to ask for a vehicle. Obviously, you need it, and you got it, and that's great. And I would say we should celebrate that. And the question of, when we're paying, when it's our dime, then we should definitely consider that more economical route. But good work.
Well, I would agree with you. When we decided to bring the community paramedic pilot program to the city, it was important to us that it did not fall on our taxpayers. There's not one dime that we're proposing here of taxpayer money, with the exception of, obviously, it's a state grant, so there is some state taxes that would be paid. But it was important for us to come in fully funded. You can see that our budget had fuel in it, it had overtime, it had vehicle, it had some community outreach. So this is a fully funded program from outside sources and not on the backs of our taxpayers.
Chief, so you might have already answered this in the presentation. I might have missed it. How long will that so it's $100,000 that's for the grant, that's for this pilot program to get off the ground. How long is this pilot program going to last?
So the initial $100,000 will last 1 year.
Okay.
That is the contract with the state of Maine. The additional $50,000 that we receive from a private donor is going to be exclusively to extend wages into the following year. So we expect this program to be fully funded for 1.5 years to 2 years, depending on how it shapes up.
That sounds awesome. Thank you.
No. Order.
Oh, this is in order, but the second reading is a roll call. The first reading can be by a show of hands.
All in favor? Resolution 165, 2022.
Approve bid award to Enterprise Fleet Management for 5 patrol vehicles.
Move to adopt.
Second.
Let us know what's going on.
Hi, Major Woods, Waterville Police Department. The chief's already kind of opened the door on this, and I'll try to make this fairly quickly because we've all been here a long time tonight. The IACP study did recognize the police fleet as an issue that needed to be resolved. While they did not specify a number of vehicles that we need, they did recommend that we develop a fleet maintenance program or a fleet management program. So even though we don't have a number of vehicles provided to us by a IACP, we do know amongst the police department that the number of vehicles that we have is not adequate. We have 7 marked vehicles that are shared amongst the patrol officers, and at peak shift at full staff, we have 7 officers working. That leaves no room for vehicles to be down for maintenance or any other reason, crash or anything like that. It's become a morale issue for the patrol officers when they show up to shift in the afternoon and do not have a vehicle to take to work. So we have budgeted this year $56,100 for the purchase of police vehicles. That is enough to purchase outright one vehicle. So we had to do some outside the box thinking here on how we could increase the number of vehicles in our fleet. And this idea actually was brought to us by a patrol sergeant who heard that Presque Isle had started leasing their patrol vehicles from Enterprise. So we've been in discussions with Enterprise for quite a while now about the lease of Chevy Tahoe patrol vehicles, and they have offered us the lease of 5 patrol vehicles for $54,365 this year, putting us $1,700 under budget. That includes the equipment of the and setup of the vehicles, and it's a 5-year lease, so we'd have 5 payments. I'm also proposing that we take 3 of our oldest vehicles in our fleet that are past their service date and trade those in. Enterprise will take those vehicles and sell them for us and return the equity in those vehicles. Enterprise does claim that they will get us a 108% return on the value of the vehicles when they sell them. As the fire chief pointed out earlier, they've been looking for Chevy Tahoe patrol vehicles as well, and they're having a hard time finding them. Enterprise has already gone out and found us the 5 vehicles in Massachusetts, and they've put them on hold for us. So if we don't act quickly, we'll soon lose those vehicles. So the other thing that Enterprise does, in addition to providing us and selling the vehicles for us, is that they will monitor the maintenance of the vehicles. They monitor the miles driven on the vehicles, and they will recommend a replacement schedule. And by switching to the Chevy Tahoe vehicles versus the Ford vehicles, the Chevy Tahoes have significantly higher resale value. Enterprise has provided me with numbers that show that the Ford vehicles at the end of 5 years are worth about $10,000 a piece. So when they sell them for us, they would get us $10,000 back to roll into the new budget for the next year. The Chevy Tahoes are worth $24,000 at 5 years, so they hold on to their value significantly better.
I have a few questions.
Sure.
So say, for instance, if one of your patrol officers goes on shift and they don't have a vehicle, what vehicle do they use? They have to, like, double up?
Sometimes they get rides, or some officer will come off the board and not be available for calls, so they can catch up on paperwork and take the other officer's vehicle. Or they share vehicles. They'll go to a call, come back, and another officer will take their vehicle and go to their call.
With the 5 lease new Tahoes, right?
Correct.
So you guys are requesting these 5 vehicles from Enterprise. This is already in the budget, so this isn't going to be any additional cost to the city of Waterville, correct? This is already this money is already allocated for vehicles.
Yes, we allocated $56,100 for vehicles this year, and they're $1,700 under budget. There will be a payment again for the next 5 years.
What about when the agreement with miles? So I mean, can you not go over, like, with the new lease vehicles? You can't go over a certain amount of miles, or
not with the patrol vehicles.
Okay.
It's essentially a lease to own program.
All right.
So at the end of the lease, they will either take the vehicle and sell it for us and return the equity, or we could choose to continue to run it. And it's about $250 to purchase the vehicle at the end of the lease. But the problem with doing that is what we've been doing right now, is kicking the can down the road with our patrol vehicles, and we end up with vehicles, like, for example, we have a vehicle that has 140,000 miles on it.
That's still in service?
That's still in service, and I drive that vehicle, and when I drive through a mud puddle, my feet get wet.
Yeah. What about, like, say, I know that you can sell the 3 more tenured vehicles back to Enterprise. What about keeping, like, 1 or 2 of them for like, an emergency reserve, or is it just better to just get rid of them? 140,000 miles on a police vehicle is astronomical.
Yes,
absolutely incredible.
I believe that we need to get rid of some of these vehicles.
Yeah.
we're doing is proposing the lease of 5 vehicles and getting rid of 3. This will increase the amount of patrol vehicles by 2 this year. And then at the end of this year, we can reassess, is that enough vehicles or do we need to expand it again? And so next year we could look at maybe leasing a vehicle but not trading one in, or any options, but Enterprise will actually track that and make that recommendation to us.
All right, sounds good.
Quick math on what you were, because I'm sitting here reading it like everybody else at the table. He's got 7 vehicles. He's going to get rid of 3. He's leasing 5 vehicles for $1,500 less than it's going to cost him to buy 1 new vehicle. So we're going to be up to 9 vehicles for patrol. Am I correct?
Correct.
I don't want to say it's a no-brainer, but if they're going to take care of the maintenance part of it, as part of this purchase of less than 1 vehicle, how much are we saving? On the maintenance side. I'm not worried about the maintenance alone. How much are we saving?
So most of the maintenance will, in addition, what I didn't mention or forgot to mention was that Enterprise does provide us with discount maintenance cards as well. So the maintenance of the vehicles is at a reduced cost.
Yeah, we're basically just taking advantage of an economy of scale that Enterprise has access to that we don't as a city by doing this leasing program. It makes a lot of sense.
And one of the big points that I'd like to make is obviously the fire department said they're having a hard time getting 1, and Enterprise has found us 5.
Yeah.
And it's basically because Enterprise does business on an astronomical scale that they have access to vehicles all over the country.
Claude's got something.
I just have a couple of quick questions. Is leasing, is that becoming a common practice for police departments?
I know of only a couple other police departments that have started exploring that, being Ellsworth just signed on to this program, and Presque Isle, which is where we actually heard the idea from. So I don't know exactly how many police departments are doing it, but it's certainly moving in that direction, I think.
So it's possible that as competition for leasing picks up, we could possibly see savings in the future. All right. Is leasing compatible to switching to hybrid or electric vehicles? That is one of the things we've been discussing at the Resilience Committee.
So Enterprise will shop whatever vehicle we want them to shop. Just the issue with switching to that right now is that our vehicles are driven 24/7, so there would be no time for charging, as well as there are no electric pursuit-rated police vehicles right now. If that were to change in the future, then we could shop whatever we wanted to. We're not stuck with Chevy.
All right, and then I did ask you if we could work the fire department in, and I understand the Chief Chief Essler is interested in purchasing one because we've got it in the grant, but I still think it's one of those things we ought to think about in a long-term basis.
So in our talks with Enterprise, we actually learned that they do entire city fleets. So they also could bring on Public Works for their pickup trucks as well into this lease program. So.
Okay, good. Thank you.
All in favor? All right. Resolution 166, 2023.
Authorizing a regular municipal election to be held on November 7, 2023.
Move to
Where are you
Move
going
to
to have
adopt.
it?
Did we get a motion on the floor?
I move to adopt.
Second.
Okay.
Where are you going to hold it this year?
The council recently voted to authorize the Thomas College Fieldhouse as the voting location.
Oh, no, I voted for it. I just wanted her to say it so everybody else knew where
Yeah.
it was going to be. Us going to say, yeah, we're going to do this, and everybody, but where are we going to go vote?
Well, everybody's just going to call you, Tom.
All in favor?
It is important that everyone knows where to go to vote.
Oh, one other question. What day is it?
November
election.
7th is the Tuesday.
November 7th.
Yes.
Purposely. Resolution 167, 2023.
Establishing hours for voter registration.
Move to adopt.
Second.
What are the hours?
Regular business hours. We won't have any extended evening hours for voter registration for this election. They're really not needed.
All in favor? All right. Can I hear a motion?
Move to adjourn.